and I'm one of the founding directors of Compassionate Communities Australia. And I've been a GP for 50 years, passionate about the journey from birth to death. I'm talking from Gamaragal country on the northern beaches of Sydney, always was and always will be Aboriginal land. Please add where you are, if you like, to the chat, and the chat is where you should share your thoughts and questions. If it stays this small, we might be able to just do a hands up or have open conversations. I'd like to acknowledge and pay respects to First Nations elders, past, present, and emerging, and to any Aboriginal or Torres Strait Islander who are here with us today. I also want to acknowledge the diverse cultures of the many immigrant and linguistically diverse people who've come to this land. I'd like to share with you some of an acknowledgement of country that a colleague, Melanie Gould, from the Bundjalung Nation in northern New South Wales, generously gave us at New South Wales Parliament House on Dying to Know Day in 2023. And she also gave it to us to introduce a compassionate community gathering that we called Who's Got My Back? That was about a month ago. So I quote, as I say, these are her words, not mine. Aboriginal and Torres Strait Islander cultures have held stewardship and unbroken connection to this land and have fostered an enduring understanding and profound reverence for the interconnectedness of life, death, the spiritual realm, and the cycles that sustain us. The concept of the eternal dreaming, fundamental to the worldview of Aboriginal peoples across Australia, shapes our understanding of existence and the relationships between individuals, communities, and the land. Life is seen as a continuous journey where birth, death, and rebirth are not endpoints, but transitions within an unbroken cycle. Death, therefore, is not an end, but a passage, ensuring the continuity of this cycle, a transition rite that connects us to our ancestors and the dreaming. In Aboriginal and Torres Strait Islander cultures, community is at the heart of existence. The passing of a loved one is not an individual loss, but one that resonates across the entire community. The period of mourning, known as sorry business, is a deeply significant time during which families and communities come together to honour the deceased, express their grief, and engage in cultural practices that reinforce collective healing and connection. Through this lens, we gain valuable insights into a more holistic understanding of death and dying, one that is deeply rooted in respect for the past, acknowledgement of the present, and hope for the future. As we open the conversation today around life, end of life, and being part of community, let us do so with sensitivity, humility, and an appreciation for the diverse cultural perspectives that shape our experiences. There is no single approach to this universal experience, but by embracing cultural learning and development, we can build a more inclusive and compassionate understanding. In the spirit of reconciliation and mutual respect, let us honour the wisdom of the past while creating a future that values the interconnectedness of all living things. By fostering respect for cultural traditions, we strengthen our bonds with one another and deepen our connection to Mother Earth. Let us walk this path together with openness, respect, and a commitment to learning from one another. So, Again, welcome to our conversation today, and as Mel invites us to listen and learn and share what we know about dying, passing. Sadly, Danni Petkovic is unwell today and not able to join us. She's put tireless work into the development of this year's Dying to Know Day. Thank you, Danni, and get well soon. Let me introduce Jessie. I've known her for at least 15 years, since the early days of Groundswell. She's inspired me to develop my work in promoting the model of compassionate communities as a remedy for loneliness and a support for the challenges of life and death. Jessie is a wise owl, a mentor for many, never one to duck a debate, and most importantly, a wonderful and loyal friend. Jessie Williams is the community manager at Provida, and through their flagship Dying to Know campaign, works nationally to make death easier. Through her own experience of grief and through her time with the Groundswell Project, she is passionate about advocating for a compassionate community's approach to end of life and increasing attention and investment into communities to lead the way. She's a TEDx speaker, and in her TED Talk, she asks, is death the way to bring us back to community? Over to you, Jess.
Thanks so much, Stephen. I want to acknowledge Danni too. She's going to be really bummed. She missed this conversation. She has COVID. She's extremely unwell. If it was a simple cold, she would be here. Stephen, what a beautiful opening. I've got both of my feet planted on the ground, and I'm so grateful for the opportunity to breathe and drop my shoulders. Like many of you in the call and many of you perhaps listening to this recording later, we all have stories, don't we? We all have a story of what brings us into this work. And as Stephen mentioned, I have a story, and mine is that my first baby died 22 years ago at birth. And when I was introduced to the Compassionate Communities movement after that tragic loss, I decided to go public with my story because I found that I kind of enjoyed public speaking. So I put that with my lived experience of grief together and the extraordinary 3-day vigil that we had with my son's body and how my community helped me survive that loss. I put those things together, and I think I wanted to share that with you all because I think that's what is one of the promises of Dying to Know Day does. It kind of helps people share their story if they choose to do that in a way that's a little bit more public. So what I wanted to do today was to show some slides and share some stories about different gatherings that have taken place over the last 14 years. That's how long this public health campaign has run. I want to give you some practical information about a grants program that we're going to launch. My goal is to do all of that in 15 minutes, and there's quite a few slides, but they're not text heavy, they're photographs. And if we've got time, I would love us to share the story of Who's Got My Back, which is this gathering that Stephen and I and some of our friends hosted recently. So give me a sec. All right, Stephen, are we good to go? Can we see these?
Now we are. We're fine.
Fantastic.
Full screen.
So, and I really want this to be interactive. So I'm going to talk at you for about 15 minutes, but please note any comments, questions in the chat, and we'll absolutely make sure that we open it up for a space to yarn. So firstly, Dying to Know has been going for 14 years, and it's really always been about the 8th of August as a national day of action to get Australians talking about death and dying and grief. But now we're going to drop that day and have an all year round campaign, but we're still having a day of action. We need that as a hook because we need to get the media and the, other organizations kind of to pay attention to the topic. So it's an all year round campaign, and Danni is our campaign specialist. And so she's 4 days a week and she's there to talk to people. So I too want to acknowledge that I'm dialing in from Canagoland, and I want to pay my respects to elders both past, present, and emerging from where I'm dialing in from. So, Dying to Know inspires local initiatives and promotes information to enable all Australians to discuss and plan their wishes. So, what do we do practically? Practically, we share creative posters and we provide a platform to register gatherings, and we design merchandise and a whole bunch of other things. I wanted to call this out because every year we refresh the creative, and the creative for us is kind of like, what's the carrot? What's the thing that really gets people's attention to this topic? And we've had some years where we've nailed it, and other years where not so much. But people who want to hold a gathering for Dying to Know, they will often take our creative and they'll use it to promote the gathering in their town. We're working hard on the creative this year. The theme is around intergenerational conversations. We've been holding some forums in Sydney, and what we're hearing is things like older people are saying, it's easier to talk to my grandkids about death than it is my own adult children. And children are saying, join, let us join in the conversation. So we're hoping that the creative this year really kind of captures the essence of that. What we also do is we connect journalists to the hosts of the gatherings to tell local stories. We try to get national media. Sometimes we do, sometimes we don't. But what I can tell you is that when the journos call us after we put the media releases out, they'll often be from local communities to say, tell me what's happening in my town. And then we will directly connect those people to local hosts so the local hosts can tell their own story. We support and we encourage hosts, especially the newbies. We get a lot of phone calls from people in local councils and in health services because they just want to have a chat about their idea and get a little bit of feedback on what it is. We certainly do our best to signpost people to other people. There is a Facebook group. I'll be sharing all of these links afterwards for hosts where that can be kind of a matching space for people to say, hey, I'm in Coonabarabran and I want to do something. Who else is in Coonabarabran? We're already seeing a few of those matches start to happen organically, which is really lovely. So we run that Facebook group for hosts. We also run a Facebook page, websites, and we have a newsletter. I'll tell you more about the grants at the end of the presentation, but for the first time in 14 years, we have funding. So yay! A little bit comes to us at Provida. Most of it's going out the door to you, to the community. And it's not small change. It's around about $250,000 that we'll be dispersing over the next 3 years. So they're seed grants, they're for individuals and they're for community-led organisations. The team is Danni. Ashley does our PR. She's on our team. We've got a marketing manager, Narelle. My job is to oversee about 7 programs at Provida. Provida is a not-for-profit charity in Sydney, and I'm pretty hands-on with Dying to Know just because it's my history. So, what's the tone of the campaign? What Well, it's love, it's authenticity, and it's compassion. And we're highlighting the word passion here. So we show our authentic selves and we express our love and passion for this part of life. And that's an invitation to people who are thinking about doing something for Dying to Know to really tap into yourself. What is your story? What's bringing you into this work? And feel free to share that. I reckon we've only got one life to live. Let's wear our hearts on our sleeve. So this is the tone of the campaign that we try to bring through in all of our communications. What I want to bring is, let me just change this, is how a pebble cast into a pond causes ripples that spreads out in all directions. And each one of our thoughts and words and deeds is like that. So with every little event, there's this beautiful ripple effect, right? And that's how the campaign enables this kind of grassroots mobilization. We see about between 150 to 250 gatherings that are registered with us every year, and we know that that number is even higher because not everybody registers with us. So here's where we get into a bit of the storytelling. I wanted to grab just a few things to inspire and get your reflections going so that it'll help the conversation afterwards. So there's a number of models and programs and ideas out there that have been global and been around for quite some time. So you can adopt one of these. So a couple of them are A Death Over Dinner, Carked It, which is a fantastic game that's just been recently released, supported by the Good Death Impact Network. And if you haven't heard of them, look them up. You can join them, and it's a really wonderful space to ideate. Um, I'm sure you know about the Death Cafe model, no agenda, cake, tea, let's just talk about death. Advanced care planning panels, where we bring in lots of different people to have conversations about the documentation. And what else? So if you want to start adding into the chat what some of those other ideas, that would be great. What you're seeing here is a before I die wall. So it's under what's called Creative Commons, which is intellectual property that can be used by anybody as long as it's attributed. And this is a chalkboard, but you can draw it up, you can put it on a whiteboard, you can use all creative manner to set it up. People have used this in outdoor areas where members of the public just walking past. Before I die, I want to. It's a great way to engage people in the conversation about life in order to engage them in the conversation about our mortality. So this is a beautiful photo that I love from my child's school. We did a little Dying to Know event with them, with the children. And this is my daughter's friend who discovered a bird that had died, and these boys were just having a conversation about it. So let's consider how we can involve schools and nature and the discovery and the beautiful natural learning that children have. Last year, I think it was last year, we decided to do a signature event at New South Wales Parliament, and Samar Owen was our guest speaker. And this is MP Jodie Harrison. And we kind of wanted to use the status and the symbolism of Parliament House to say, let's talk about death, baby. It won't kill you. Definitely involving your local MP is always a really good idea. Ellen Kelleher will say, bring the parade to the politicians. And wherever, it's useful, let's draw on formal leadership and what that represents. Men, men, men. That's all I'm going to say about this photo. There is one woman in the photo, but I love it because we don't often see groups of men in the compassionate communities movement or for Dying to Know. So I put it in there because that's what I like to see. So workplaces. This is a compassionate workplace gathering that we had last year for Dying to Know. So from left to right, we had an aged care CEO, another aged care CEO. We had a primary health network, a health commissioning person, and our friend Stephen, our local doctor. And in the background, some evidence about how we really grieve. So let's bring this conversation into workplaces and have a good time while we're doing it. As part of the same workplace initiative, we had the amazing Trish Carpenter, who's from Brisbane, and she has lived experience. She's got two children, and one of them died through cancer, and she's also a teacher. So she's combined her skills of teaching and public speaking with her personal story, and she's developed her own workshop around supporting people in grieving with grief at work. And Trish and I partnered to bring this gathering together, and it was a pretty powerful combo. So this is a photo from Tambo in Western Queensland, and we had a Dying to Know chat there, and the woman wearing black, her name is Maureen, and she's the local community connector type person. By connector, I just mean informally, like everyone knows Maureen. Maureen knows everybody. And we were told by some health colleagues, if you want to have a yarn in Tambo, give Maureen a call. So we rocked up and she got the Bush Telegraph going and everybody came to the park. And I just adore this photo because it says so much. You'll see over to the right, we have a young Aboriginal woman there who's got her child in a pram, and she has about 3 different health roles in the community. She's chatting to Annie, who's a palliative care specialist. Over to the left, sitting at the table in the middle of the 2 women, you've got Amber, who's a primary healthcare nurse. And the rest of the women are just locals. Many of them have cared for their husbands. The idea that this group came up with at the end of the 2-hour chat was they wanted to create a simple fridge magnet that had a whole bunch of local phone numbers on it for people who needed support at end of life. And so we prototyped that for them. We did it in Canva. We sent them the design and they did the printing locally. So think of gatherings that enable people to let their eyes wander. They're not all staring at a screen, right? They're just looking and thinking and yarning. So this is another moment where we held a workshop and everyone was sitting in sort of classroom style with tables facing a group of us sitting at the front having a conversation. And we realized 5 minutes in that this gentleman with this striped shirt, he wasn't able to hear us very well. So we invited him to just come and sit with us. So we sat together. We invited him to sit in between us. We moved our heads from side to side to spray the words. We shared the space equally. So whenever we have that feeling of kind of over formality because someone set up a room in a certain way or we thought it needed to be in a certain way, always notice and pay attention to whether or not everybody's being included. I love this photo too because it's from a intergenerational practice conference that I went to recently. So I want to acknowledge that conference and the photo that I took from them. And again, it's easier to talk to my grandchildren than my kids. There were so many other insights that we gained from our forum that we're going to share them through the launch of the Creative this year. I just wanted to put this in to be sort of a teaser. How can you involve this intergenerational aspect? This was an expo put together by Maxine and her team at Southwest Sydney from Liverpool Hospital. I was able to pop along, and what I loved about it is the diversity. They had buses coming in from many different cultural social clubs to come into this one day expo. They shared a lot of people's different resources, health and community. And so when we're gathering for Dying to Know, don't just share your own resources, use it as a bridge to share everyone's resources. Because what we're trying to do is we're trying to encourage people to be their own investigator. And not to say this thing is better than the other thing, but to really stoke their curiosity and learning. And last year, the theme was people's shoes and floral arrangements denoting sort of the individuality that we have in terms of our wishes. And so they incorporated that into the actual expo, which was kind of cute too. This was a meeting that we had with Longreach Council. So I wanted to make sure that councils were in here because they're a really wonderful stakeholder for Dying to Know. Surprising to me, in Longreach, they have a funeral director on staff because I guess the funeral owns some of the grounds, the burial grounds in that sense. So we had a conversation about what sort of gathering that they wanted to put on, and their idea was to have a sort of a fun comedy slash information night, which is you can't ask that. And so everybody put their questions into a pot and then they pulled them out. And that was sort of the event. The funeral coordinator was a bit nervous about her role in this. And so we were able to sort of chat with her over the phone and build some confidence there and to be her ally in that work. Stephen, you mentioned 15 years. I thought I should put this photo in there. This is the lovely Holly to the right, who now is with the Help app at La Trobe University. But I've labeled this photo Enduring Relationships because, oh, sorry, it makes me cry a little bit. Because this work can be tricky and we always want to play the long game. Oh, now I'm crying. But trust and relationships is everything. So make sure you're building relationships for the long haul. Okay, so this is a photo of Who's Got My Back, which is a gathering that we pulled together recently. What I might do is I might pause it there because I don't want to talk at you and I open it up for questions and then maybe what we can do is come back to Who's Got My Back because there's quite a bit to share and I would love for Stephen to share his thoughts there as well. Um, I might pause it there. Any reflections? And then what I'll do is I'll also come back and give some practical information about the grants program.
We can use the hands up. There's no questions in the chat. People have mentioned Swedish death cleaning, grief walks, legacy questions, getting your social media sorted. before death workshops.
All great topics for dying to know.
Yeah.
You've whet my appetite. I want to know what Who's Got My Back is about.
Oh, really?
Yeah, like this amazing image, and then I'm like, what happened?
Oh, no. Okay. All right. Well,
That
should we go
others,
back to that?
that's just me. Yeah.
Yeah, let's
Yeah.
do it. So Stephen, I'll kick off the
Sure.
description, then I'll share it. So five of us got together. Now it was made up of a GP, Stephen, myself on salary, community engagement, bit of a mixed bag, a retired school teacher who had a connection to this particular school, a semi-retired community development manager, and Danni, dying to know. and um, and another member of my team who's a psychotherapist. And so we got together and we had about 5 meetings over Zoom that went for about 40 minutes each. And we started to talk about this idea that actually first came from the community. And Helen was the retired school teacher who was kind of representing her community group. We started talking about things like where are we going to have it? How are we going to invite people? What do we call it? How do we use language? Do we call it death stuff? Do we put the D word in there? Do we use compassionate communities? What do we do? So we decided on a couple of phrases that were important: compassionate communities, death literacy, and Stephen came up with the title, Who's Got My Back? And what we did was we came together on a Sunday. This was at Kinmar School Hall, which is a Steiner school. It was a perfect setting because it was situated in nature, and you really felt like you were kind of going to a retreat without the scariness of that retreat. I don't know about you, but retreats freak me out, as the name. Um, and we asked people to bring a plate of food. Under no circumstances were we going to cater because we were not providing a service. We were creating a space. Everyone brought a plate of food. Um, we set the room up in a wonky circle, as you can see. This is not a support group. This was not a counseling circle. It was a gathering and it was a conversation, and there were layers, as you can see, but we made sure it was wonky to start with. We set up a table with a whole bunch of resources, but we gave a very clear message that this is just stuff from our house. I bet you've got some stuff too. What would you add to it if you could? We planned for about 5.5 hours of time together, and in that, we planned about 40 to 50% of actual activities. And those activities were designed to help people, to create the conditions for people to share their experiences because we shared ours. And that created an enabling environment. And the other activities were about sharing information and knowledge. And so one of those activities was open space, which is a very simple activity that anyone can do. You go to ChatGPT, say, how do I do it? And open space is based on the idea that when people show up, they can say, I want to host a conversation about this topic, and anyone who wants to join them can go and join them. So we spent the sort of last 2 hours in open space. We said at the beginning that at the end we were going to invite people to put up their hand to organize the next one. And we've already booked the hall for you and it's ready to go. And we're here to support you. So as Peter Kenyon, Peter Westerby probably says this too, but I think Peter Kenyon said it to me once, make sure you open the doors and windows for community, and that's all you do. So that was our version of that. And at the end of the session, at the end of the day, two people put their hand up and they're going to be organizing the next one. What happened in that 5.5 hours was so beautiful and so extraordinary. One person was overcome by their grief, by a loss that was at least 30 years, I would say, Stephen, and they needed to leave the room. And one of our team went out and sat with them and had a chat until they were ready to come back. It didn't feel like that was a risky, bad, sad, terrible thing. It felt like a very normal thing, and we all held the space for that without it feeling heavy. Going in, I felt as a facilitator, I felt like we've got this because I knew that my four friends had my back and I had theirs. And we were very intentional with the space that we were opening up, but also very, as part of that intention, very clear that this was shared accountability and responsibility. We only brought expertise out when it was asked for. We did not open the space with expertise. Stephen, that's just off the top of my head. What would
Yeah,
you?
yeah, no. Well, you did which we might share. You did a very good document that summed up some of the tips, perhaps, and they were just the tips that some of them emerged during the day. But I should make it clear that I am a GP. I look after about 30 residential aged care facility patients and also people in the community who are dying. So I respect some of the medical skills that I've been blessed to have and learn. But I also know that death has become over medicalized. And so these 15 years, if you like, though the first practice that I helped set up in London about 45 years ago, it was on the basis of a community, and we had an open space rather like this, and people would come and they'd talk to each other about their illnesses, and while they were waiting, we've made it clear that, obviously, if you want to be private about it, you can be private about it, but otherwise it was a community experience. So the idea of who's got my back is because I believe we need to use everyday language about this stage of our lives. I mean, it really applies to every stage of life. Perinatal, mothers on their own, mothers with children with disabilities and a new child, adolescence, menopause, frailty. We all need to wonder who's got my back. Yes, there may be family, but really our culture has not created an assured who's got my back. Just moving away in the foreground there is our daughter who I was talking to her, and she said, "Oh, I could sing a song if you'd like." She went to this school, so she was a bit interested to come back 40 years later and have a look at it. And I think it is important to have some performance arts in any meeting like this, in any of our discussions, meetings. So she provided a song, and I'll actually, I was fiddling around to see if I could find it. And she wrote the lyrics the night before. She's a musician. Who's got my back when the sun don't shine? I've run out of time. Who's got my back? Who's got my back when the seasons change? Nothing stays the same. Who's got my back? Knock on your door. Never asked you before. You're busy, I'm sure, but I just can't take much more. Who's got my back? Who won't turn away? Hold my hand and say, I've got your back. I've got your back. And she got a chorus going for everyone, and that was great. She actually said that she'd never had such a responsive chorus, call and response. So something was happening in there, and there it is. There it is.
I'll add on to that, Stephen, too. We wanted to bring the children's voice in as well without actually having children there. So, and I didn't come up with the idea, my daughter did, but she created this, she called it positivity potluck. And so in this basket are little colored bits of paper, and there's a little jewel that kind of seals them. And we passed the bowl around and everybody opened them up. And some of them were beautiful, kind of like, you've got this, or believe in yourself. And others were, eat more cheese. I mean, they were just random things that my 12-year-old decided to write. So it brought the humor into the room in a really lovely way. So we can bring children's voices in without worrying about working with children's checks and all those sorts of things.
Yeah, and I'm hoping that the simple concept of who's got my back will make a big difference to what's coming in July. Well, it's been going on for millennia, and our culture is just realizing, or the bean counters in health are realizing that they can't put everyone into hospital. Only 11% of people die at home. And so if you want to die at home, and that's part of our plan, is to see what we can come up with to help people die at home. And I know when I'm part of a dying at home experience, that you really have to have 5 people if you're getting near. You've got a chronic disease, you need to go to doctor's appointments, you need someone who can nip down to the chemist, someone who can sit with you, give you a hot drink. I always reckon a hot drink's as good as a hot line, if not better. But so you need to know 5 people outside the family who've got your back. And then if you want to die at home, you need 10 people outside family to help you die at home. That's separate to all the services. And some of you would know about the 95-5 rule, where 95% of most people's experience when dying or near death or frail, 95% is without any services, and 5% is when the nurses come by, or physio, or they're helped for a shower by one of the workers. So it's that 95% of the time of someone's life in that situation that we need to cover, and that's where I came up with the idea of who's got my back. And when that's seeded to families who want to do it, the further out from the crisis time, the better. And you shouldn't call it the crisis time, because for many it isn't a crisis. It goes very smoothly, especially if they've gathered 10 people to help them. Okay, that's all I've got to say.
Thanks.
Don't get me started.
Yeah. If there's no burning questions, I might just finish the slides off, and then we'll get rid of these things and have a chat. Are there any questions? Otherwise, I'll keep going. Okay, I'll keep going.
Oh, I was going to just say, Mel, who gave that lovely acknowledgement, she was just sitting at the front there in her
yes, good call out. So, so the grants program that I've just mentioned, this was the pitch to give you an idea of the purpose of the grant. So death and dying and end-of-life care is a national priority that needs local solutions. Government prefers to fund community-based education, not community-led education. There's a really important distinction between those two. We're missing out on harnessing the wisdom and natural inclination for collective community support to improve end-of-life care. So be part of the ripple effect to change death in Australia. So sparking local action by offering seed grants to individuals and groups eager to create positive change in their community. We believe that diverse approaches lead to unique solutions, and great ideas deserve to be nurtured and turned into meaningful action. Now, these ideas can be events or gatherings for Dying to Know Day. They can be projects in the sense that they're not just an event, there's something that can go over time. But also they can be products, because as I mentioned earlier, one of our jobs at the campaign is to develop merchandise to help people have tools to use as an engagement, a way to engage human conversation. And we would love to see more of those things developed in the community. Because we can only do so much and we're a small team and all that sort of stuff. So you could apply for a grant because you want to develop like a series of tea towels or something like that. That would be really, really cool. So it's open to individuals and groups, as I mentioned. There are 2 levels of the grant. The first is what we call micro level, which is up to $500. That's for an individual or a household. So maybe an individual as part of their family or their group of friends wants to do something. And the meso is up to 5,000. So that's more for either large groups of community citizens or actual organizations. What we'd love to see through that is more engagement with neighborhood centers, with councils, local clubs, schools. So some of those civic-based institutions, organizations, to get involved because we need to make space for death, don't we? Our responsibility, as far as I'm concerned, is to make sure that it's a really simple application process that's very timely. So we're still confirming these details, but it will be a simple web form, which will be tell us about you and your idea. What have you done already? Because we do want to see a bias to action. How much money are you asking for? What do you want to use it for? It's not like a council grant where we want to see quotes and an actual budget. We just need a rough idea. What do you think is novel or different about your idea? So, if you'd like to use it for catering, for example, that's fine, but also that's perhaps a missed opportunity to have a partnership with another organization to bring food in or to bring a plate. So we don't want to just have the grants be used for things that um, could be done without money and also a great way to build a bridge, if you kind of know what I'm saying. So we do want to understand a little bit about how the grant will help bridge something that needs to be bridged. And are you willing to share photos and story for the campaign? We hope that you are because then we get to put it all over the socials and inspire new people to come in. That's pretty much it in a nutshell. And in terms of when we're going live, where our goal is in 2 weeks. So certainly by the first week of June, that application process will be open. And we're hoping to have a turnaround of like assessment and feedback or confirmation within sort of 3 weeks of receiving it so that it's fast for people. And once we open, it's throughout the year and it's for the next 3 years. So I'm going to stop talking. Just throw it open.
Well, Nikki has got a question.
Mhm.
Is there a time frame of when you need to have completed the project?
No, because we're talking social change. So, I mean, maybe if I said that, someone in my team would go, Jessie, that's not practical. Um, but like if you said we want to do this thing and we think it's going to seed something for next year, or we don't know how long it's going to take, just put the idea through the portal and help us learn how to be as adaptable and open as we can because we don't, as the administrators of the grant, we don't want to misstep on what the community needs. So I'm sorry, that's not a clear answer. It's a philosophical answer. We're going to be learning a lot this year about how to administer them in a way that really does share power. So
Then Ross Evans asks, is the funding open to local authorities?
yes, we can, there are change makers in every institution across the country. So yes.
So we're running at the moment, you might have seen it advertised on the newsletter. We're running a 6, 8, is it, Cheryl? Meetings with Julian Abel, who was a palliative care specialist for all of Southwest England. And he was one of the people involved in the Froome project. And he's doing a educational series for us every Thursday night. And when he came to this point and he said, any questions? And the screen was silent. He said, if no one puts up their hand, I'm going to pick someone. Old school teacher approach. I won't do that. Well, I might.
Sounds like a threat, Stephen.
Well, it is a threat. It was a
It
threat,
is.
but it was done in a very humorous way. It
Of
was
course.
good, and it got some questions. So if I was going to ask a question, I'd be pointing at a man because we're so poorly represented, despite your slide. Yes, we're so poorly represented in this field, and I suppose I put the question out: why are men so underrepresented in this area?
I've just unmuted or asked you to unmute Ross so you can have a chat.
Well, I just wanted to say last year we held quite a few events here in Albany for Dying to Know Day throughout August. But one thing I was trying to organise was a workshop to understand story time and what death means to First Nations Australians. That kind of fell away by the wayside a little bit because we couldn't get the groups together in time, but hoping to get it sorted this year. Just wondering if ever anybody's done something similar and what kind of format you did and how did it work out?
I'm happy to jump in there. Well done, Ross, on bringing this in. Thank you. So for Advanced Care Planning Week, we partnered with Eliza Munro from Queensland, who developed a resource called We Need to Know Before You Go. And we came together for a yarning morning, and we had Koori Connections do the catering, and we had the resources there, and it was a very informal conversation. But in terms of like genuinely engaging with local mob, we knew that with a 4-month time frame that was not going to happen. So we thought, let's just do this thing and then hopefully meet some people and have some conversations and then kind of co-create something for the next year. So that's just my top of mind experience. Other people will have more, I'm sure.
Okay, cool. Sorry.
I'm just thinking, that there are the men's sheds and there's a lot of them, and that might be a way of offering to go and start the conversation about death and dying. Emily.
Well, it was one of the things that came to mind when you were talking about Dying to Know You, especially Dying to Know You Day, is obviously seeking permission and letting people know that would be the topic of conversation, is to kind of collaborate with communities that already exist. So whether that's a craft group, whether it's a walking group, whether it's sort of, just looking around your local Facebook groups to see where people are already coming together with a purpose. And again, with express permission from the organizers and everybody in that group knowing what's happening, is to go and kind of have a special, craft afternoon where, I don't know, everyone brings in a jumper or a shirt or something from somebody who's died and we craft with that, or whatever it might be, but just to sort of really think imaginatively about, because sometimes creating a space can feel really overwhelming for people. So sometimes just collaborating with spaces that already exist. And I did have a question about Dying to Know Day, the day specifically. I understand that it's a year-long campaign or a forever campaign. So if we were to do something, I'm actually not in the country on the 8th of August, but if we were to do something for the day itself, are there packs that can be sent out? Do you send out like questions to help people facilitate? One of the things I was thinking about was not having people in a room. I'm personally much better at opening up and talking about feelings when I'm in movement, when I'm in nature, which is why I was suggesting brief walks. But as somebody who's actually not going to be in the country on the 8th, I was thinking about just sending out to my community a list of questions in terms of legacy. So questions that you might just pick up the phone and like call your dad and be like, hey, Dad, tell me the story about the day I was born. What do you remember? Because so much of dying is this feeling of it all being final, right? But actually people live on through stories, and those stories die with people if we're not quick enough to elicit them. That's my brain dump.
Love it, Emily.
Love it.
And the simple answer is yes. We've got some really wonderful young creatives in the team who are working on some of those finer ideas, but a good reminder too to have things that are not in person for the day itself. So thank you.
A bloke on the line, I suppose. So if I could have a word, that'd be great. I'm also a scout leader, so I work with the youth side of things, but we're talking about intergenerational, and so we might be able to work with a lot of, as you were talking, Emily, about existing spaces the Scouts have a vast program of what we try to achieve in our youth training, and one of those programs of work is around the spiritual side of things. And so this would come in very easily into that line of learnings that they go through. So might be something we can put together for the actual Scout Association of Australia to implement in their program of works. So I've been talking with also Palliative Care Tasmania around grief, that they've put a package together for children and also for adults. So it seems to go hand in hand, being able to put a group together and have maybe just a around the fireplace chat type of thing with children and their parent or grandparents as well. But I just call them more responsible adults.
Love that, Peter. I think that sounds great. And yeah, I'd encourage you to pop that in the Facebook hosts group, because then we can chat about it and other people can kind of join in. And it probably is a good fit for a grant too, just to, because sometimes these small grants can help open doors. You may not need that help, but if it helps open doors and gets conversations prioritized.
I was thinking around a repeatable program that can be utilised for, like, we're always looking for things to do this week or in the program next term type of thing. So it could be something that people could, Scout leaders around Australia could grab a hold of and go, hey, this week we're going to talk about death and dying, and with your intergenerations within your family. So yeah.
Well, if anyone ever says, oh, you wouldn't want to talk about that with children, you can tell them that a GP told you that almost all deaths that I've been at, the adults are hanging about in the kitchen, and it's the children who are saying, and I usually say, does anyone want to say goodbye? And the adults hang around in the kitchen and the children say, can I have a look at Auntie? So the curiosity is
absolutely
there. Yeah. So we're coming near end of time, I think. We've got about 5 minutes left. If anyone has some burning questions, if not, I'm going to serve everyone up with a Simone de Beauvoir quote that my partner
Well, just a quick call out to, we're going to do monthly, if not more, just online hangouts too for Dying to Know Ideas. So the next one is June 11th at 1 p.m. Sydney time. Again, we'll put that in an email and a follow-up. So yeah, feel free to join.
Did you guys mention did you say a Facebook group for hosts or something?
Yeah, I'll get that link now for you, Bonita.
Thanks. Yeah, I run a regular death cafe in Melbourne, but I've just had approval from I work at Very Special Kids, which is paediatric palliative care. And so I'm running a staff across our organisation, so not just our family support team, but our hospice team and our admin team, so like across to the fundraising side, and admin, and inviting a staff only sort of internal death cafe, just to try and sort of build that. People assume everyone that works in paediatric palliative care is death literate, and it's not the case. And obviously at a scale, so I just I'm doing that. Yeah, I'm going to organise that at work, but I'm also wearing two hats in that. In my own time, I do want to. Yeah, I sort of want to run something in my community outside of my work in this space, and I'm sort of toying about, death and drinks or death over dinner or something like that. So yep.
Food works.
It does, doesn't it?
Always.
Yeah. Give something for your hands to do.
Exactly, yeah.
And I just want to echo what you were just saying then, Stephen, about children in those spaces. Yeah, I was a funeral director for a while too. So children are absolutely our best educators in death. Yep.
Well, it's great to have you there in Victoria.
Yeah.
We'd like to think that Compassionate Communities Australia is all of Australia, and good to have you call in from Victoria.
Death by chocolate. There was a registered event, I think 2 years ago, which was a death by chocolate in Queensland. Peter, is that the one you're thinking of, or have you just come up with that idea? No, new one?
I'm in Tasmania.
In Tasmania.
Ah. So what have we got? We've got Victoria, we've got Tasmania, we've got New South Wales, we've definitely got WA. Nikki,
And Nikki?
you're muted.
Queensland.
Oh, good. All we need is ACT and Northern Territory.
Well, in the last Dying to Know hangout, we actually had Northern Territory on the map, and we've never had a registered event in Northern Territory before, so times are a-changing.
Yeah.
It's good.
Great. So, look, thank you for coming, everyone. My quote is maybe on topic for people. It is by Simone de Beauvoir, and my partner Jenny sent it to me the other day. Growing, ripening, aging, dying, passing of time is predestined, inevitable. There is only one solution if old age is not to be an absurd parody of our former life, and that is to go on pursuing ends that give our existence a meaning, devotion to individuals, to groups, or to causes, social, political, intellectual, or creative work. In old age, we should wish still to have passions strong enough to prevent us turning in on ourselves. One's life has value so long as one attributes value to the life of others by means of love, friendship, indignation, compassion. So I'm 77 and I'm taking that to heart. Thank you, everyone, for coming.
Thank you, Stephen.
Lovely to
Thanks
see
for
you.
hosting ComCommers. Thanks, everyone.
Thank you. Bye.